Hello, pet parents, and welcome to another edition of Natural Pets TV. In this season, we have done something really special. We've listened to all of you. That's right, we're going to be focusing some of our episodes on cats and some of our episodes on dogs. We know there's so much that you want to know about each of these wonderful species that we have assembled experts that are going to not only enlighten you, but take you into a deeper level than we've done before. So this is going to be a great year of Natural Pets TV. We're going to start off this episode with cats, and I am really excited by the experts that we have. We have Heidi Nevela, Dr. Liz Bales, and Dr. Ken Tudor. And I am really excited to talk about this topic because it's something, as I have gone throughout the pet world, that many people are confused about. And I'm going to be interested to hear all of your opinions and views on it. I like to call it the systemic cat. In other words, when one system is under attack or maybe failing, it has an impact on other systems throughout the body. Where do you all stand on it? And I'm just going to pick someone randomly. Dr. Liz Bales.
I'm so glad you asked. So I think you bring up a great point in just your introduction to the show, that dogs and cats are very different. And when a person who's familiar with dogs thinks of a dog in distress or with a failing system, those signs can be pretty obvious or demonstrative. And then when we think about cats, we need to take a step back and realize that cats are a very stoic animal. And so they might not show you signs for a really long time, or that those signs would be very subtle for a long time. So any mild changes that you see, like not being as playful or not coming out to eat as often, or mild changes in diet or litter box habits, are a sign that you might want to pay attention earlier rather than later, before these things can add on to themselves like that.
I think that's really important because cats, unfortunately, when a system is failing, they will shut down, if you will, and they will do more hiding. They will let themselves become even more debilitated. So it's so important to recognize symptoms early to keep that from happening, because it's that death spiral we get into at the end that is the problematic, in my opinion.
And from an herbalist perspective, we have probably a similar approach, maybe just different tools, but we have a remedial or symptomatic response, which is common to all of us. But really the foundation of herbal medicine is root cause, which really isolating into what systems might be impacting. Typically with herbs, conditionally in cats specific, like urinary tract infections or crystals or stones, that kind of formation, there are go-to products. But if those are not responding or successful enough, then we move into other systems. Normally they do well, but that's where the cat system gets a little more complicated. And thankfully, in some of the more prevailing issues, herbs do tend to be very successful in meeting those needs. I'll give you an example, see if you want to weigh in, tone in on this, but we get, probably for cats, the biggest request we get is for urinary tract infections or stones and crystals. And we have an herb called Chancapedra that is highly responsive. It's what I call, it's got a great anti-panel, it's an antilytic, it's antispasmodic. It will reduce smooth muscle, go for bacterial, viral, fungal infections, microbial infections, anti-inflammatory. But the point is, if that does not impede the cycle, then we move into central nervous system, neurotransmitters that might be failing. Defective bladder tissue can be an issue related to inflammation. So that's the approach that we take in herbally, or like a holistic approach, I should say.
And then to build on that, particularly when it pertains to urinary issues in cats in general, we find that the environment of the indoor environment for the cat has a lot to do with urinary issues in general. Right. And in so many cases, particularly with humans, we want to say there's a straight line between the problem and the solution. And in cats, so often we find that they don't have a lot of ways to exhibit their distress or their problems. And so they kind of have a couple go-tos. They'll urinate or defecate outside the litter box. They'll vomit. They're not really very specific to the specific problem. And in urinary issues in general, that could be tied back to a lack of an enriched environment. Right. And what a cat perceives as stress from not having their indoor environment set up the way that makes them feel safe as a predator-prey species. It kind of gets pretty swirly. There can be a lot of things going on. So some of them medical, some of them environmental, and it takes a lot of sorting out to try to figure out exactly where the root cause is, as you say.
I think that's why holistic people are drawn to holistic medicine for cats, is because the Western notion of making a straight line diagnosis and treating specifically probably doesn't do well with them. We need to take into consideration these other things, and I think traditional Chinese medicine tries to do that as well, where we're not looking at a specific problem, we're looking at a pattern, and then trying to put all of the energy in a balance so that we don't have this deleterious effects on other systems.
And that's exactly right, because really ultimately at least for herbs or plant and marine-based components, is to restore balance in the body. And there are proactive things you could do in your home environment for pet parents and for their cats. Diet always comes up. I'm sure you talk about that all the time with your pet parents. Moisture is important. That alone may reduce a lot of the problems. Limiting stress in the environment, that has a lot of effects too in terms of what it does in terms of meriting disease or maybe causing inflammation to set up the susceptibility. But so we look at all of those things too from an herbalist perspective, but absolutely the end result is, okay, here's the condition, whether it's an allergen, like we have a lot of repertoire, like a lot of herbs and repertoire that we use, but no matter what the presenting issue is, we have go-to products that are specific to that body response, but then we draw it from there.
And I want to focus on something that you said, is it's hard to come up with a treatment plan if you don't have a diagnosis.
Right.
And I want to make that really clear to the
Right.
viewer at home, that particularly because cats, as I said earlier, can be very subtle in their signs, having a visit with a veterinarian that you trust and that you feel you can communicate well with and ask good questions of, and that they can ask you the proper questions to be able to isolate what they should be looking for in your pet, that they do a good physical exam of your cat, and try to get to the root cause of the problem. Without a diagnosis, it is difficult to provide proper care. And as much as we want to take those things into our own hands in a loving way with our pets, we cannot discount the importance of a veterinary visit to be able to get to the root cause of the problem.
Absolutely agree with you. Really, when people call us, they've already done their due diligence, and they maybe even tried something that their vet recommended, and maybe it allayed it but didn't disrupt it. And that's another area where South American herbs that I interact with and use can be really effective because they're adaptogenic. They actually, in some cases, not all cases, but in some cases, the core actions of the plants are to interrupt cycles. So for instance, we talk a lot about urinary tract or stones. There's a plant chemical called geranium, and that's specific to breaking up antolithic situations. And it functions as a preventative, but we don't get those calls until the pet parent already thinks. We don't advise to self-medicate, or if your cat's going outside of the litter box, you have to step back and think it may not specifically be UTI. It could be behavioral related to some stress in the home environment.
And ideally, we want to create a situation where the pet parent and the veterinarian and alternative medicine are working together and communicating really well with records keeping, so that we're not overlapping a medication that shouldn't overlap, because herbs and medicine can cause some effect that is not good.
Right.
So that we're all really on the same page communicating about what's best for the cat.
Last season, it was suggested to keep a pet diary, and I think that's such a great thing to add into as a pet parent, because then you see the pattern, especially with cats, which if the symptoms are more elusive, then you now have a chronicling, and you can better communicate with your veterinarian. If you want to try something that's integrative or holistic, you now have some other information to draw on.
Right.
So.
And with cell phones, that makes it even easier. I can't tell you how many videos I watch in practice. People come in.
Tool.
This is what happened at home.
Oh,
and,
great.
which is much different than how they're acting at the practice, because all the epinephrine's going in their body, and they're not acting abnormal whatsoever.
Yeah. And a video is just a wonderful tool
is.
because our perception of how a cat might be acting may be very different than the reality of it. And so if we're all looking at the same video together to interpret the behavior and the clinical signs, it's a marvelous tool.
Well, folks, as you can see, there is a lot of great information that we're going to be sharing throughout this season. I hope you've picked up a few great tips, and I'd be remiss not to remind you, get that pet journal started right away if you haven't already done it. Thanks for joining us here on Natural Pets TV. Hey everybody, thanks for joining us on Natural Pets TV. We want to keep the conversation going in the comment section down below, or you can always reach out to us at petworldinsider.com. You can get more information from our great guests by reaching out to them as well. Heidi Nevela at Natura Pets with a Z.com, Dr. Liz Bale at NoBullCat.com, and Dr. Ken Tudor at WellDogPlace.com. Let's keep this going. Let us know what you want to be talking about, what you want to hear from us. Thanks again for joining us, and don't forget to hit that like button.